Thanks very much. We are delighted, GBMC, we're delighted to be here with GBS and HCI and all of you. We are a community-based provider of health care, and we are trying to become more patient-focused. We've extended hours of operation. Dr. Motter is going to tell you about the patient-centered medical home now not really being about an individual visit, but about being a relationship with a patient. We have our physicians now better understanding their role as the leader of a team.
What it is. We joined the Accountable Care Program that is sponsored by CMS back in 2012. So we are one of, I think it's 4 ACOs that are up and running now in Maryland. And we were the first hospital to have one of these. When Obamacare came in 2010, coffee early enough, that our goal was to have an empty hospital. And I'm surprised some of you didn't say, what are you talking about?
We were thinking that.
Yeah, you're running a hospital and you want it empty? Well, that's true. That's exactly what we're trying to accomplish as an organization. And what we've been looking for since we started this journey in 2010 is a partner that can help us reach that, to have the financial incentives in place, but also have the back office and the care teams involved to make that a reality. And that's why we're very excited about this project, because we finally found a partner that is willing to do something different and to really put something out into the market that is going to improve people's health and then incent
this patient-centered approach has to work within the plan design. So a couple things that we've done is we've wrapped it with wellness design elements, and there's a bunch of them. So there's a whole selection process for you all with your customers to say what's a level 1 wellness, level 2, level 3, level 4. These are elements that you all are doing today. You're working these things out, whether it's screenings, etc. But that incentive management system is built into this with the PCMH program. So very different, a very, very different model. And you'll see that we've got the incentives right for the providers. We need the incentives correctly done with the members, and then the incentives for the employers is cost savings. So we've got to be able to sell that to our employers.
I didn't tell you, but my PCP took me off my blood pressure medicine last week.
Phenomenal. That's right. So good news. By the way, that's really nice. It cost me less too.
It was generic.
It was a bit. Now you're talking everybody's language. In terms of wellness seminars, you saw that transformations happening with our providers, our doctors, the people that we go to have our children. And they're on board with this idea that we've got to drive better health care, we've got to manage costs, and we've got to help people stay healthy. So it's very exciting times. You are the first. You are the first to take it out to market. There's no plan like this on the planet today. So
we started at 663 emergency room visits per 1,000 for the Medicare population. We're down to 583. So we've cut 80 visits per 1,000 out of the emergency room. So we've been able to cut that cost curve because, as you probably all know, that is the front door to a hospital, the emergency room. That is the most expensive place to get care anywhere in the country, and maybe anywhere in the world. So we've gone from a $700 visit for a sore throat in an emergency room to a $60 visit in our primary care offices. So we are ready, willing, and able to serve your clients. We will reduce cost. That's a promise. And we have a very great partner that's going to help us do that, because as a healthcare provider, we don't intend to get into the insurance business. That's not our thing. We don't know how to do that. Henry and his team do. So that's why we need a good partner that can provide everything we need to reduce costs for your clients and all the businesses in this market. And we hope that everyone will use GBMC, and we promise to take good care of everybody. So with that,